Welcome to 6 months of parenting. Your baby's now 6 months old. She should be able to recognize familiar faces. She'll laugh and squeal. She probably likes to look at herself in a mirror and will take turns making sounds with you. She'll reach out and grab something that she wants, and her tendency is to put everything that she can grab into her mouth. That's how baby explores the world, which makes now a good time to double check your home and make sure that anything that she could get a hold of is not poisonous, sharp, hot, or choking hazard. Your baby should be rolling from his tummy to his back and will push up with straight arms when he's on his tummy. He may be able to sit up for short periods of time by himself and will lean on his hands to support himself when he's sitting up. Your baby will enjoy time spent sitting up but can't get there on her own yet. So do help her to get to that position and allow her to look around. If you haven't already been doing so, I highly recommend reading to your child every day. Reading time is quality time spent together with your baby and is a good way for her to learn about language. Play games with your baby like peekaboo and patty cake. It is not recommended to let babies under 2 years of age have any screen time or watch television, videos, games, or phones. One notable exception to this might be video calling with loved ones who are far away. It's been shown that babies learn well by talking, playing, and interacting with people. But for reasons that are not clear to scientists, this does not occur in the same way from exposure to recorded speech or television. Giving babies screen time also can make an early start to a habit that it will be difficult to limit later on. Your baby's first teeth usually will come at about 6 months of age, usually beginning with the front 2 teeth on the bottom. But not always. Every baby can be a little bit different. As soon as you see teeth, do start brushing them. You can use a baby toothbrush if you want to, or a clean washcloth will do just fine. Put a little bit of water on the toothbrush or washcloth and brush all the teeth that you can see. Dentists sometimes recommend brushing the gums even before you can see the teeth. And they'll tell us that it's safe to use a very small smear of toothpaste, with or without fluoride, when you brush baby's teeth. Brush your baby's teeth once or twice every day. If you have well water in your home, your baby may need extra fluoride. Ask your baby's doctor or your family's dentist about this. Don't put your baby to bed with a bottle. This can cause damage to the teeth from bacteria that'll grow on the nipple of the bottle and then in the baby's mouth. Don't share spoons with the baby or clean his pacifier in your mouth. Never pre-chew food for your baby. At 6 months of age, most babies are ready to start some solid foods. I recommend beginning with baby rice cereal to get the baby started. Mix a small amount of cereal with breast milk or formula until it makes a loose, soupy consistency. Then feed that to her with a baby spoon. She may do great with that right away, or it may take a few attempts to get her to eat off the spoon. Once she's eating well off of a spoon, you can start introducing some other soft baby foods. Start with the Stage 1 baby foods. Stage 1 foods have only 1 ingredient per dish that you would introduce to the baby and are a very fine, pureed consistency. It doesn't matter what order you introduce new foods in, you can do whatever you'd like to there. But I do recommend giving a few days in between each new food that you introduce to the baby so that if the baby has any troubles with any of the new foods, it'll be easy for you to tell which one caused the problem. After the baby's taking a good variety of Stage 1 foods, you can move into the Stage 2 baby foods. Stage 2 foods typically have more ingredients per dish and a little more texture to them. Most babies won't be ready for Stage 3 baby foods that have some chunks in them until they're 9 to 11 months old. As you introduce new foods to the baby, it's okay to give him some soft table foods that are the same consistency as the baby foods. Avoid anything that has honey in it, though, for the baby's first year. Honey can have some bacteria spores in it that don't cause any problems for older kids or grown-ups, but they can make babies sick. Offer solid food to the baby 2 or 3 times per day, and let him decide how much to eat. If the baby leans back, turns away, or closes her lips to show you that she doesn't want more food, then it's time to stop. It may take 10 to 15 times of offering your baby a particular type of food to try before he actually likes it. So don't give up on foods that baby doesn't like right away. It used to be that we recommended avoiding foods that are common allergies early on, like eggs and peanut butter. But newer research has shown us that introducing these foods early on may actually help prevent food allergies. So feel free to let baby try those foods. If the baby does already have allergies that we know about, including asthma or eczema, or if there's a family history of food allergies, ask your baby's doctor before introducing these foods. Be sure your baby is riding in a car seat that's appropriate size for your baby and is rear-facing and in the back seat all the time. Babies should never ride in the front seat, especially in a vehicle that has a passenger side airbag. Remember that if it's cold, thick layers of clothing or puffy jackets can actually interfere with the car seat's ability to hold baby safe if there's an accident. Place the baby in the car seat with only 1 or 2 layers of warm clothing. You can carefully put a blanket or jacket over the top of the baby once she's buckled into the car seat. Just be very certain that those blankets or jackets are not in the way of her breathing. Always lay your baby to sleep on her back. This is the safest position for a baby to sleep in. If she rolls over on her own, you can allow her to stay that way, and always lay her to sleep on her back when you lay her down. Because your baby is likely to start crawling around and grabbing things and putting them in his mouth, double check your home's safety to be sure that baby won't encounter things that are sharp, hot, choking hazards, electrical cords, latex balloons, or any amount of water. This includes bathtubs, toilets, and swimming pools, but it also includes small amounts of water. Even a dog's water dish can be enough water to get a small child in trouble. Always be sure baby is supervised, and never leave the baby alone in the tub, near any water, or in high places like changing tables, beds, or sofas. Never use a baby walker. These have not been shown to help babies learn to walk any sooner, and they've been associated with a bunch of tragic accidents. Keep your baby out of direct sunlight, and when she is in the sun, put a hat on and use sunscreen with SPF of 15 or higher on any exposed skin. If the baby is going to be outdoors where there's risk of insect bites, some insect repellents are safe for babies, but you need to check the labels to be sure. Insect repellents containing DEET, the most common insect repellent ingredient, are not considered safe for babies. Some insect repellents containing lemongrass or vanilla are more likely to be safe. Again, check those labels. At your baby's 6-month-old checkup, she should be due for booster immunizations against diphtheria, tetanus and pertussis, polio, hepatitis B, pneumococcus, and possibly Haemophilus influenza type B or rotavirus. That sounds like a lot, but don't worry. Some of these are combined, and in most clinics that will be 2 or 3 shots. At 6 months old, your baby is also old enough to get a flu vaccine and COVID-19 vaccine. These are both highly recommended and may require more than 1 dose. Please ask your baby's healthcare provider for more details. I also recommend that everybody in the family get their flu vaccines every fall and updated COVID vaccines. So think about getting your own flu vaccine and bringing in the rest of the family too. Your baby's next checkup will be due at 9 months of age. He may or may not be due for vaccines at that time. If you have any questions about taking care of your 6-month-old, please ask your child's healthcare provider or drop them in the comments for this video. Parents, you got this. See you soon. Please hit that little thumbs up to like this video, subscribe to our channel, and then hit the little bell so that you won't miss a thing.